My name's Clark Otley, and I'm the Chief Medical Officer of Mayo Clinic Platform, and I'm a dermatologic surgeon at Mayo Clinic in Rochester, Minnesota. Well, Mayo Clinic Platform is a new aspirational vision of Mayo Clinic. It's essentially taking data that we all have as patients and making sure it's de-identified and privacy protecting, and then combining the data from lots of different medical centers so that we have solutions that are developed through advanced analytics that help predict the future. So the goal is that your doctor and your healthcare system will be able to know more about you in a very personalized way and be able to make early interventions rather than late interventions to help you. We want actual outcomes that make patients' health better and providers' ability to care for patients better. And so part of that is developing what we call solutions. These are the tools that help a nurse know which patient of the 10 patients they're taking care of tonight might be having a problem, so that that nurse can focus on that patient more and early intervene. And those solutions are usually data-powered analytics, often AI-powered, artificial intelligence-powered. And a platform is essentially this open ecosystem where one group, and that in this case is Mayo Clinic, sets some rules. And the rules are, you've got to have high quality, it's got to be scientifically based, and you've got to privacy protect the data, and you need to work together with us under Mayo Clinic values. If that's the case, we welcome groups from all over who are developing these AI solutions to participate, and they have a lot of different ways they can participate. We're going to make sure that the doctors and the nurses have the information they need to understand how to use these AI tools so that they use them appropriately, don't overinterpret, don't underinterpret, and all of this is aimed at essentially making better healthcare for our patients and our communities by making super doctors and super nurses. Artificial intelligence is the use of a computer to do something that a human would otherwise do. So helping a machine make your job easier or more accurate. We're not at the point where we can just let the machines do healthcare. We're nowhere near that. And in fact, I don't think we're going to ever want to have that state, because medicine is a human interaction, and you need the human oversight, you need the human judgment, and you need the human compassion to make sure that we get it right for individual patients. But what machines can do for us is really augment us and help us, because I'd say it's pretty hard to be a really good doctor and a really good nurse. It requires a lot of mental energy, and it requires right now going to lots of different data sources and bringing them in and pushing them into your head so you can make a good decision. And what we're hoping is, instead of us having to gather so much data through sheer mental energy, that the data would be gathered for us because it knows what I, as a dermatologic surgeon, need to know to take the best care of my patient, and it presents that data to me in a format that is standardized, that I know that I need. It makes me be a better doctor without as much cognitive wear and tear. So the machines are there to augment and make our doctors and nurses better and more efficient and less burned out. They're there to make sure that the amount of data that's put under consideration is really large and rich, so that we can maybe even in some situations have insights that a doctor or a nurse wouldn't have. But there's always going to be that human element where we touch the data and understand and interact with our patients so that we get it right for them.